Good afternoon. Do you believe urinary tract infections, UTI, can be diagnosed in 15 minutes with high accuracy? Maybe let me give you some background about UTI. UTI is one of the most common bacterial infections in men, affecting millions of people worldwide, and at least 50% of women is suffering from UTI in their lifetime. The diagnosis of UTI can be quite simple based on symptoms. However, some patients can have no symptoms at all. For example, pregnant lady. In that case, if left untreated, may complicate with preterm delivery and premature babies, which is totally disastrous. Or for young child, they are not able to volunteer the symptoms. So what can a doctor do? They will usually rely on laboratory markers and tests to help diagnosis, which we call laboratory medicine. And for UTI, conventionally, we use dipstick test and bacterial urine culture for the test. However, we know dipstick test is just a paper test interpreted with color changes with very suboptimal diagnostic accuracy, whereas bacterial culture with high accuracy, it takes a long time in terms of days. Imagine if you were the parents of the affected child, or if you were the pregnant lady, do you still want to rely on these tests? Here, we developed a novel diagnostic approach for UTI using a simple test in 15 minutes with high accuracy. Here is the hypothesis. We hypothesize microbes will produce specific metabolites and go into the urine. And these specific metabolites will be useful biomarkers. And we use a method called metabolomics to study all these metabolites. Metabolites will be sorted from thousands of peaks into meaningful peaks. Metabolomics is a new scientific discipline, so even this term is not yet appear in dictionaries. Now you can see through this approach, we can classify infection, the green ball, from non-infection, the blue ball. And the significant peaks here, acetic acid, is the magic diagnostic biomarkers. Using acetic acid, we measure it from urine. We found that UTI patients have very high level, but not in normal control. And the diagnostic performance, it has a sensitivity of more than 96%, whereas conventional approach is less than 60% or just 40%. So with an improvement of almost doubled. So using this approach, we were able to diagnose patients from symptoms to diagnosis in only 15 minutes. So we changed the practice, whereas conventionally in terms of days. So we're moving from research to clinical translational medicine. This work have also been presented in an international conference in UK and received an award from Metabolomic Society. And using the same approach for studying other disease, we also received an award from Australia. So we envisage this test will be a meaningful and useful test in future clinical practice. Thank you very much.